The Osun Health Insurance Agency, in collaboration with the World Bank, has commenced sensitization and enrollment of 1,500 women into the Osun Health Insurance Scheme in order to improve their health status in the state. The enrollment process commenced on Monday in Ikperindo at Akomosa East Government Area, and the team moved to Okeila and Ora Igbomina, both in the Federal Local Government Area, on Tuesday. The Executive Secretary of OSHIA, Dr. Ademola Adeleke, who led the team at the two towns on Monday and Tuesday, revealed that the women were chosen based on their vulnerability by the Women Affinity Group.
They were here for the sensitization and enrollment of women affinity groups in Akomosa East Local Government in Ikperindo. We are here right at the town hall, and this is the Kabiesi's Palace. And inside this hall, we have women affinity groups that are 15 in number, and from them they have chosen vulnerable women that are poor and vulnerable. They are here, and we are enrolling them. After sensitization, we are enrolling them so that we can capture them and give them the card with which they are going to be receiving treatment order under Health Insurance Agency or Health Insurance Agency for the next 1 year. These vulnerable women are being enrolled at this moment. You can see they are capturing going on. After capturing, we are going to go through all of the documentation, and then they will be given their cards, and then they will start accessing care from the primary health center that is here to the other secondary facilities under Nigeria for Women project.
Speaking on the sustainability plan of the agency, the secretary has this to say.
There is a sustainable plan. Number one, Osun Health Insurance Agency that operates Osun Health Insurance Scheme has two programs for the poor and vulnerable. The first one is the Basic Healthcare Provision Fund program of the federal government for poor and vulnerable people. And the second one is the State Equity Program for poor and vulnerable people funded by the state government. We already have that. So this woman, this is serving the Nigeria for Women project, is serving as a gateway, as an entry for them into the social health insurance net in Osun State. So once the project, ramps up, they automatically, convert to Osun Health Insurance Scheme, and they continue with their benefits. And we are praying, not everyone that is poor and vulnerable today will remain poor and vulnerable for many years. Once their health is taken care of and they are able to make wealth, they can come out of the poverty bracket, and then other people can come in. And so this is meant to remove more and more people from the poverty bracket.
He also stated the persons living with disability in the two communities also have their vulnerable groups program of the health insurance scheme.
Oh yes, persons that are living with disabilities in Ikperindo, even the male, this is just Nigeria for Women, even the males that are poor and vulnerable, they have the program, the vulnerable group program of the Osun Health Insurance Scheme. So under OIS, they are covered. When we started OIS, we went around everywhere. We took all the leaders of the people that are living with disabilities, the albino community, the people that have neural problems, those people that have physical problems, we brought their leaders and we enrolled them. We have over 70,000 poor and vulnerable that were enrolled. Amongst them, all the various groups that makes up JONAPRID. JONAPRID is the Joint Association of People that are living with disabilities. All of their groups are represented in the poor and vulnerable program of Osun Health Insurance Scheme.
The vocal officer for Nigeria for Women project in Osun State, following short summary, stated that the project is directed towards eradicating poverty brackets among women.
The program addresses women, and it's addressing women from different perspectives. We want to eradicate poverty among women. We are using 11 platforms, 11 MDAs that will address women in different perspectives. Like what we are doing here today is OIS program. OIS is bringing women, vulnerable women on board to secure their insurance, their health insurance, at least for 12 months, a year, such that they don't need to pay for any health services in their local area.
Representatives of the local governments applauded the state government for the initiative. They also implored the agency to improve the number of staff around the maternities in the community.
My advice is that this program should be extended to every other part of the state. That's number one. Secondly, the number of people they intend to capture, I will appreciate, I will advise that they increase the number, because like this local government, like I said earlier, majority are basically peasant farmers, and their source of income is so small and narrow, and they need this health assistance a lot. So, and lastly, I will advise that the governor help us mainly on our maternities, because majority of the maternities are short-staffed. You go to a maternity, some of our maternity, you have only one staff. In fact, there are places you go to, the one staff will be will be volunteer. Somebody will volunteer to be taking care of people there. So I will appreciate it. I will advise that the governor make more efforts in engaging more hands in our maternities. Likewise, in terms of drugs, they should try and at least increase.
In an interview with Inside Links TV, some beneficiaries of the project appreciated the state government and agency for sensitizing them on the need to enroll for health insurance scheme. They said,
a wá ṣe prógámù OIS fún ètò ìlera adójútòfò everything. A dúpẹ́ lọ́wọ́ gọ́fúnà wa fún ìgbésẹ̀ tán gbé yìí. Ọlọ́run á máa ràn wọ́n lọ́wọ́. Wọn ò ní rí ìjàmbá, wọn ò ní rí farapa. Ọlọ́run á túbọ̀ dán máa gbé wọn.
A dúpẹ́ lọ́wọ́ ìjọba pé wọ́n ṣe ń wá o, pé tá ń ṣe yìí o, pé a mọ rírì rẹ̀ o, kán túbọ̀ wá mọ̀ bá wa ṣe lọ, kán mọ̀ jẹ́ kó sú àwọn, kán mọ̀ jẹ́ ká pákún wọn, Ọlọ́run ló mọ̀ ra wọn náà lọ́wọ́ o.
That of the Olaoluwa government will be held on Thursday, and no fewer than 500 women are expected to benefit. OSHIA Health Insurance Scheme has in the past taken the awareness of scheme to the rural communities as a way of saving several lives through delivery of quality health care. From Oshogbo, Modibola Show, Inside Links TV.